Well, I first want to just thank you all very much for the opportunity to talk here this afternoon. I think this is a great event, and I think that dialogue, asking questions, challenging the status quo, recognizing and adapting to a changing environment are important for any organization or community. As you know, or many of you know, I have spent my career, and I guess my dear wife would say my life, in healthcare. I've learned a lot, and I've learned it from many great people in many great places and roles. And I would like to share some of those learnings with you today that I hope will stimulate some further discussion. In the Wenatchee area, we are really blessed with, I think, a great community, with many bright, energetic, life-loving, and hard-working people. We are a community. And a community to me is defined as a group of people who all live in the same area, having shared interests within society. I challenge all of us to think about the idea that we are one community. Can we act like one? I think if we look at the slide on the screen, we look at how we live. The legal boundaries of our cities, counties, fire districts, and school districts do not match our work, our lives, our recreation, or our economics. We live in one city or a county, but we can and do work, recreate, learn, or shop in another just as easily as where we live. The Columbia and the Wenatchee rivers are natural wonders, no longer dividing this community, but rather giving us a focus for recreation. The river is also the focus of our economy, with the PUDs and the electrical generation they bring, tourism, and irrigation for our agricultural economy. These are all parts of our local economies and all of our legal jurisdictions. It is now time that we look at how we provide community services or public services in this vein. The boundaries of the cities and the counties here, that's East Wenatchee. There's Wenatchee. I will submit are artificial lines on a map from the past. What does and should the future look like? Do they make any sense, these maps, relative to what is located on one side of the line or the other? Healthcare and government or public services share a commonality. We are both service industries expected by all residents of these communities to be there for everyone in the service area, with our success not judged by monetary measures, but rather by the ease of access to high-quality, effective, and efficient services when they are needed. In healthcare, as in government or public services, there's an increasing expectation of what services can and should be provided, in what time frame, with what complexity, but with minimal or no increase in resources to provide those services. For Confluence Health, this has led to a realization that the status quo is in how we operate is really not sustainable and has shifted our thinking and culture to a real focus on value. To me, value in this context is defined as the outcome for a specific work that is generated divided by the cost and the effort required to provide that outcome. In healthcare, a simple example is to look at a joint replacement. We know what somebody feels like before a joint replacement. We know what kind of a functional ability we would like them to have at the end of that joint replacement, and we can measure the cost. If we can get a better outcome for people at a lower cost, that's an improved value. In this era of limited resources, then you can increase the value by improving the outcomes lowering the costs, or both? I think we need to ask, what kind of outcomes do we expect from government or public service? Access also has to be considered. The highest value product or service without access is worthless. To me, in healthcare, there are three broad categories of outcomes which occur in various stages of anybody's life. First, there is improved health. And when that's really no longer possible, then really the focus needs to be on improving the quality of life. And then when that is no longer possible, we must aim for a reduction in people's suffering. This quest for value in healthcare has led to a strategy of regionalization. This allows for a maximum utilization of people, knowledge, technology, and infrastructure to all of its top of its license, the top of the individual's skill set, or the maximal appropriate use of technology or infrastructure. It's led to a significant effort towards reduction in work that does not improve value. This work is all waste. This effort requires standardization of work and standardization of process. As a couple of examples, in healthcare, the cost of a specialty physician is about $4 a minute. A primary care physician, $2 a minute. A physician's assistant, or ARNP, about $1 a minute. A registered nurse, 60 cents a minute. And a medical assistant, 35 cents a minute. An MRI scanner costs $1.4 million to purchase, and then there are the operating costs. An operating room is $53 a minute to have available. So to improve this value, we need to maintain or improve our outcomes while reducing cost. We need the specialty physician using their specialty training as much as possible. Similarly, from the primary care physician, the physician's assistant, the ARNP, the registered nurse, or the medical assistant. We need to provide care the right way, in the right place, at the right time, and at the right cost. Healthcare is an industry late to this realization compared with many other industries. Prior to this era, we have been a craft industry, working alone, in silos. However, I will argue the advancement in knowledge and technology in the last couple of decades have now allowed us to be determinations and know what the best way to manage many conditions or illnesses is. Henry Ford taught us this lesson many years ago in the auto industry. Prior to Henry Ford, cars were a craft product, not available to everyone. They were expensive and they were unreliable. Mr. Ford then built cars on an assembly line. He built a standard product with people working at the top of their training and their skill level, and we got the Model T Ford, an improved car, more reliable, and available to the middle class. And that has continued today. High-quality cars at a lower cost and improved transportation value. Regarding this whole issue of value, though, there are cons, I think, to this approach we need to talk about. First, the good old days where we were comfortable and things were predictable is gone. And we have to look at the work not in silos, but rather in a team or collaborative way. That leads to a significant loss of individual autonomy and control. There is more personal and organizational accountability for the outcomes of what you do or what you provide. For any one individual, this is extremely disruptive, but I think we must all agree and will agree for the greater good. It gives the best opportunity for what we call sustainability and long-term viability. When I look at the services that government, public entities provide locally, I see many areas of regionalization of community services which have improved the value of the product. And we did it working together. The health district, the Humane Society, mental health care, public transportation, the Wenatchee Valley Chamber of Commerce, and post-secondary education here at Wenatchee Valley College. Shopping in retail, while really not a public service, is a community asset that is delivered regionally. But I think there is more that we can do, that we must do together. As an example, I think about schools. We have 2 school districts in our community. We have a high school with grades 9 through 10 in 2,000 students, and one on the other side of the river with about 1,850 students between 9th and 12th grades. Learning data would suggest that the best school student size to maximize learning of knowledge and socialization skills to provide a high-value education is between 1,200 and 1,400 students. Can we join together as a community to look at this, not as, not as 2 artificial legal boundary-driven entities? What about a 3rd high school for this valley? Fire, police, parks are other areas for consideration. These services are all necessary for a viable, sustainable community. We need them all to be as high-value services as we can get them. It is time in this community for a concerted discussion and effort to define the outcomes we want and how to reduce the cost, to reduce the waste, to improve the value. We need to do this together. This journey in healthcare is not easy, and it is not finished. And I'll argue that it's not a paved cowpath. As I hope you can see, it is disruptive and it is uncomfortable. But we are learning and striving to improve the value, the access to services, and we will continue to do so in iterative steps. I hope as a community we can all learn from the Confluence Health experience and continue to make better this one great community we are all privileged to work and live in. Thank you.